and I'm pleased to serve as your moderator today as part of the COVID-19 Vaccine Town Hall series. I'm pleased to be joined by a great set of expert panelists who we'll introduce in just one moment. The purpose for the Town Hall and discussion today is to continue to support, provide information, and also ensure that individuals of all abilities have their questions answered regarding COVID-19. As Michigan has navigated and moved through different phases of the pandemic, it's important that we ensure people with disabilities as well as caregivers continue to have a voice and have their questions answered. We know there are continued challenges regarding access, transportation, scheduling, and more, all of which we will have our expert panelists discuss today. Now I'd like to pass it over for some introductions. Let's start with Dr. Bagdasarian.
Good afternoon, everyone, or sorry, good morning. It's still morning. My name is Natasha Bagdasarian, and I'm the Chief Medical Executive at the Michigan Department of Health and Human Services. I'm also an infectious disease physician and epidemiologist. Thanks for having me on today.
Thank you, Dr. Bagdasarian. Let me pass it over now to Annie.
Hello, good morning. This is Annie signing. My name is Annie Uraski. I'm the director of the Division on Deaf, Deafblind, and Hard of Hearing with the Michigan Department of Civil Rights. My name sign is a letter A right here on the chin, so I'm happy to be here this morning.
Thank you, Annie. Sharon.
Good morning, everyone. I'm Sharon Milberger. I'm the director of the Michigan Developmental Disabilities Institute, or MyDDI, at Wayne State University. We are a federally mandated University Center of Excellence on Developmental Disabilities, and every state and U.S. territory has a federally mandated university center. So for the state of Michigan, our University Center of Excellence is housed at Wayne State, and we work with people with all types of disabilities across a lifespan and across the state. And we serve as the bridge between academia and the community, and our mission is to promote community inclusion and quality of life for people with disabilities and their families. Happy to be here.
Thank you, Sharon. And Dr. Davidson.
Good morning. Thank you for including me in this wonderful panel. I must admit that I was as excited to learn as I am to share. I am board certified in internal medicine and pediatrics and practice currently with the Bronson Healthcare System in Kalamazoo, Michigan. Did my training at Wayne State University, including both medical school and residency at the DMC. I also have a son with Down syndrome, and through that have continued my education well beyond medical school in terms of how difficult it can be sometimes for families to manage the system, and have tried as best I can to share that with my own students that I currently teach at Western Michigan University, as well as in my own practice. I have, through my son Burke's participation in Special Olympics, I've met many people in our community that have joined my practice as patients with special needs, and that has been an honor. So I'm looking forward to participating this morning. Thank you.
All right, well, thank you, and thank you all for being here today. So let's just dive right into some questions. To begin, let's start talking about where we currently are at in terms of Michigan response to the COVID-19 pandemic. Dr. Bagdasarian, can you talk about the current phase that Michigan recently entered in the fight against COVID?
Hi, this is Natasha Bagdasarian, and yes, I'm happy to talk about that. We're in a relatively good place right now in the pandemic. The question is how long this will last. So if I can just paint the picture, we recently went through a surge of Delta variant, and that was followed very closely by the Omicron variant surge. And so we're in a place now that is relatively safer than how things have looked for the last several months. And what that really means is that our case rates are down. They're down all across the state and really in most parts of the country right now. But it also means that our health systems are less stressed. And that's been a big problem. That was a big problem for us in the fall and the winter, where our health systems were really feeling the strain of COVID. So we are in a better place in terms of case rates, in terms of the type of testing that's going on and how many people are testing positive. And then of course, in terms of how our health systems are faring. when I say it's unclear how long this will last, I say that because we're in what we're calling a recovery period. This is a period where our community members should feel relatively safer than they have for the last several months, but it doesn't mean the pandemic is over, nor does it mean that we are out of the woods. What we're doing at the moment is looking around us, looking at other states and other countries, and doing what I'm calling horizon scanning and looking for the next threat here to us in Michigan. And that could be from a change in the weather where we would expect to see increased cases. It could be when schools reopen in the fall, or it could be a variant of concern. And so we're in this lower risk period, but there will be a time where we come out of this lower risk period and where we start to see more cases again. Thank you.
Great, thank you. Sharon, recently the Michigan Developmental Disabilities Institute completed a statewide needs assessment. Can you talk a little bit about that, maybe about some of the results and really the greatest needs that came about that facing individuals with disabilities and their support systems?
Yes, great. Thank you, Tim. This is Sharon speaking. And every 5 years, my DDI, as part of our federal mandate, we conduct a statewide needs assessment, which includes people with disabilities, their family members, caregivers, professionals, and basically the people in their support circle. And this past year, we were due to do our needs assessment. And of course, we were in the pandemic. So we asked specific questions about what the impact of COVID-19 has been and what some of those needs are. So these were the top 5 needs that were recently identified, and they're in order. So they were social inclusion, direct support workers, mental health, employment, and education. And I just wanted to point out particularly that top finding of the issue of social inclusion is consistent with findings from a recent, the National Core Indicators, or NCI, did a COVID-19 study. And respondents in Michigan, the majority who are people with disabilities, reported that they were going into the community less often or not at all, and that they were seeing friends or families outside of their home less frequently or not at all.
Great, thank you, Sharon. Well, let's, as a full panel, maybe talk a little bit more about those challenges. You know, for a question for the full group, what can we do as Michigan communities do to support those individuals with disabilities as far as care, housing, employment, or even social activities that Sharon mentioned? You know, as we begin to emerge from the pandemic and as everyone starts to enjoy time together again, we know that this is a community that continues to need some support. And so to the panel, what can we do or what can communities do around this?
This is Annie signing. I can jump in here. I think it's a critical point for especially people with individuals with disabilities and other communities to understand that we're not a one-size-fits-all community. Everyone has different needs, different experiences, different preferences. They might experience different barriers. So a critical piece is the understanding that there might be additional accommodations, there might be additional flexibility needed, and framing things as we move forward from more of an inclusive mindset. That's going to be critical. Also, I believe that is the priority, number one, and making sure that we treat everyone the same with the same level of respect and show that we value people in the same way. There's a lot of individuals who are uncertain as to what's going to happen next, a lot of uncertainty. We've been through so much in the last 2 years, and everyone might feel, how do we handle what's next, what's coming, that uncertainty, how can I become more engaged? People are thinking about these things now. So we need to have that empathy and that compassion and treat each other as the same way that we would want to be treated. And I think that piece, it's important to frame it like that. And when we're talking about inclusion, it's critical that we consider intersectionality within the disability community. So we all have different levels of experience, especially during the pandemic. We all had different experiences and we continue to have different experiences. So recognizing that and being aware of that and making sure that we're not overlooking anyone or any additional concerns or barriers or needs as we move forward. Thank you.
Tim speaking. Great. Thank you, Annie. Yes, Dr. Bagdasarian.
I wanted to add one point that I think is a little bit more niche and not such a broad response to your question. But when we think about decisions that people are making at this stage in the pandemic, I think we have to realize that everyone is coming from a different place. Everyone is coming from a different comfort level and different medical history, different needs in their families and those around them. And so as a result, we may make different choices, especially when it comes to things like wearing a mask. So there may be people out there who feel more comfortable wearing a mask because of their own individual medical needs or the medical needs of those around them. And I hope that we can enter into a place where we respect other people's choices and where there is less sort of judgment and politicization around some of the choices that we're making for ourselves and our family members.
Great, thank you. Yeah, exactly right. And to Andy's part of that inclusion and understanding and meeting people where everyone's at on different levels. So yeah, thank you. Dr. Davidson.
Thanks. I think it's almost unfortunately that we started the term social isolation very early in COVID. And what we really know is that we needed to have some physical distancing, especially with the earlier variants. But we really need increased social connections. And so looking for creative ways to do that. I think, for instance, Special Olympics, so many families were missing their ability to participate with their teams, not only for the physical outlet, but for the social connections. And I really appreciated the programs that were sort of turned. My son was able to participate in something online where he connected with a group of other people and a trainer that led him through some exercises safely at home. And if we could try to create some more opportunities like that, and also look forward as we kind of are able to restart some social activities as springtime hopefully is coming in Michigan, we can safely get outdoors and do some distance physical activity outdoors. So I think that we just need to, I think it's been hard for a lot of families feeling like they're getting mixed messages and misinformation, but really to stay up with the current guidelines and to gently kind of re-enter the social community, and for larger groups to try to create more options online or in smaller breakout groups and kind of redefine how we used to do some of the big things. Thank you.
Yeah, thank you, Dr. Davidson. I think one of the themes that a lot of us heard from the past couple of years, and you mentioned, is kind of getting away from the social isolation. So many times in speaking with different stakeholders of various groups of individuals with disabilities, unfortunately, isolation was kind of a norm even prior to the COVID-19 pandemic, and how this just continued to exacerbate everything. And really, it takes community, it takes connection, and really kind of an eye-opening thing of how can we do more. And so hopefully from that, communities, groups have learned some lessons, as you mentioned, continue to connect virtually, continue to do, in person when it's safe and up to individual choices. So thank you on that. So let's kind of continue on that conversation of community, maybe outside of some of the issues we've already addressed, as we know that there's some additional areas of need, including mental health and education around some of the effects of the last few years. State of Michigan has rolled out some great support programs such as Stay Well, Michigan Cares, and other programs to specifically address mental health and educational needs. Opening it up again to the panel, What do you think, and again, for our communities in supporting these needs for individuals with disabilities and really kind of tackling some of these additional mental health and educational needs that have really come to light? Sharon.
Thanks. This is Sharon speaking. A couple thoughts related to that and that came up in our needs assessment is just the need for training for mental health providers that to work with people with disabilities and to make sure that people with disabilities are included in mental health efforts. And also, I think there is an opportunity with telehealth to have increased outreach for services. So just a couple thoughts around activities there.
Thank you. Annie.
This is Annie signing. Yes, I agree with that. I think it's also critical for service providers to understand communication needs for the members of the deaf, blind, and hard of hearing community when it comes to communicating or communication access, where we are a unique community. I think it's critical to think about accommodation needs relating to interpreting services, captioning services, as well as making sure there's additional options if you have them. For instance, say a member of the deaf blind community, say there's a video option that might not be the best fit for them if that's the only option. So we have to make sure we're more inclusive in that and including that into our training. That's going to be an important point and piece we need to add in and focus on. And as we are seeing the use of telehealth exploding right now, and we need to make sure that our community is being served and also is being filtered through that process and those lens as medical service providers. Thank you.
Thank you. All right, let's keep moving on. Dr. Davidson, this question will be for you. We know that while cases, hospitalizations, and deaths have decreased over time, as we've shared, there are risks that still exist, particularly for those who are immunocompromised or have additional underlying health issues. Can you talk about what can be done to protect those who continue to have some increased risk, whether immunocompromised, underlying health conditions around, and just maybe share with us some thoughts or ideas for supporting individuals and being safe out there?
Sure. Well, I think the good news is that individuals with immunocompromise are really themselves and their families probably most appropriate about taking precautions for themselves. I think some of the sickest that we've seen in the hospital and many of the deaths were those that didn't think they were vulnerable and therefore had bad outcomes, unfortunately. But I think the reality is also that we need to continue to educate, because a lot of people with medical problems and complications and immune problems have some vaccine hesitancy and things like that, that really when you sit down and educate them, when they are able to talk to their own specialists and the primary care providers that know them the best, they realize that they should really be kind of at the head of the list of getting vaccinated. So I think the biggest thing is continued communication with the teams of people that know you best, ongoing conversations that involve primary care providers, subspecialists, and include families and the individuals themselves to make sure everybody is protected and that we can move forward safely. Thank you.
Great, thank you. Dr. Bagdasarian. Oh, I think you're still on mute.
Thank you so much. Sorry about that. Very typical for 2022 Zoom. I wanted to just also mention that we have tools available to us now in 2022 that we didn't have last year or 2 years ago. And one of those tools are an amazing array of therapeutics. So we not only have antiviral pills that reduce the risk of severe outcomes and death, and monoclonal antibodies, but we also have medications that can be used as pre-exposure prophylaxis for those who are at highest risk. And one of the things that we have experienced as a state is that we have not been able to get those medications into the hands of patients as we would have liked. And I think some of that is because these are new medications and physicians are just learning about them. But I do want to urge any of your viewers who are immunocompromised to talk to your physician about Evusheld. So that is a monoclonal antibody, long-lasting as a pre-exposure prophylaxis that can really improve your risk profile if you are someone who is extremely immunocompromised. And then for those viewers who do get COVID, talk to your physician or your health provider about medications like Paxlovid or monoclonal antibodies that could, again, reduce your risk of death and severe outcomes. So we're just trying to really get the message out, not only to physicians, but also to patients who could really benefit from these therapeutics. Thank you.
Great, thank you. That's some wonderful information and knowledge. Want to follow up, Dr. Bagdasarian, on a kind of initial question in regards of where we're at with the phase of Michigan. And we had a comment through the Facebook Live group. Individual stated, child is immunized, wears a mask, social distance, all the right things in protection, but there is potential fear of another wave coming, seeing some of that in other countries now around the world. Would you like to just maybe speak to that of risk of future waves?
Yes, I think that's a great question, and I'm happy to respond. I think we will see future waves of cases. We will see future surges of cases. And what we are aiming to do is to prevent severe outcome and death. So what we're really looking at around the world are any markers that signal to us we could be seeing a wave that is going to impact us in terms of those severe outcomes. So there will be cases of COVID-19. I think that the virus has entrenched itself here in a way that elimination of the virus anytime in the near future is a pipe dream. So we are not able to eliminate COVID infections right now, but what we're trying to do is prevent those severe outcomes, which means that if you are vaccinated and boosted, your risk of having a severe outcome is significantly less. So the best way to protect yourself and to make sure that even if you do contract COVID, it's a milder case, is to make sure that you're vaccinated and boosted. And then for those who are at higher risk, as I mentioned, there are both pre-exposure prophylaxis medications that we have available, as well as therapeutic options if you do get COVID. And then, of course, as a state, we continue to look around us, look at other countries, look at other states. Right now, we're very closely watching what's happening with BA2 around the world. So as many of you may have heard, there have been increases in cases of BA2 in places like the United Kingdom, in Asia, and in other parts of Europe. And so we're watching those very closely to see what that could mean for Michigan. But again, if we see an increase in cases, but we're not seeing severe outcomes, if people are not ending up in the hospital, if they're not dying from COVID, that's really what we're trying to prevent now. And again, the best way to make sure that you are safe for future surges is to make sure that you're vaccinated and to make sure that you've had your booster. And guidance around that is likely to change in upcoming months. It's very possible that there may be more boosters in the future. And that's only because the virus has been with us for a short time and we're still learning about long-term immunity. So we're going to continue to look around us, look at other countries, look at other states, and inform the public here in Michigan appropriately if we do see another surge imminent. Thank you.
Great, thank you. So let's maybe have a kind of follow up on that and continue the discussion going around vaccines. As we know, that's the safe and effective way of continuing to manage COVID-19. With the vaccine now available to those that are 5 and older, more than 66% of all eligible residents here have received the vaccine. I'm going to start off with you, Dr. Davidson, as not only a doctor, but as you mentioned, a parent of a child who has an intellectual disability. What advice would you give for whether it's parents or individuals with disabilities or their caregivers about receiving the COVID vaccine, as we want to continue to try to increase those rates and get more individuals vaccinated?
Yeah, thank you. This is Melissa Davidson speaking. I think the important thing is that just to continue to communicate to the public that even though the numbers are coming down, we still have to be very proactive and follow the changing guidelines about keeping up with vaccines and boosters as we kind of define where we're going in the future. And that you know, there's some people that were hesitant in the beginning that were considering it, and then they are sort of now stalling. We're kind of seeing those vaccine rates stall a little bit because people are feeling, well, maybe it's not as necessary as numbers come down. And the answer is this is a really great opportunity. As Natasha was just mentioning, we are expecting that, you know, the BA2 is kind of on the rise, and there might be other variants. There will be other variants after that. And so the best way to stay a step ahead and decrease severity of illness and death in the future is to continue to vaccinate. That's a message that we're really loudly speaking to our patients and families in the office.
Excellent, thank you. Anyone else have anything to add on that? Right. Sharon, question for you. You know, what work is being done to provide health care, including the COVID vaccine, or even in just general information to individuals with disabilities who we know have been disproportionately impacted by COVID?
Sure, and this is Sharon speaking. So several organizations, including MyDDI, received 3-year funding from the Michigan Department of Health and Human Services, COVID-19 Vaccination Supplement 4, to ensure greater equity and access to vaccination, so COVID-19 vaccine, boosters, and other vaccines to those disproportionately impacted by COVID-19. And as you mentioned, people with disabilities have been disproportionately impacted by COVID-19. And several of us that have this funding, including MyDDI, the Autism Alliance of Michigan, the Brain Injury Association of Michigan, and Disability Rights Michigan, are joining together to form the Michigan Vaccination Partners, or MVP. And MVP we're in the early stages, but it's a statewide initiative to create a consistent vaccination clinic experience that is accessible, inclusive, and welcoming to all Michiganders, including those with disabilities. And we want these health events, these MVP health events, to have the same look and feel and standard of excellence, regardless of where you are in the state. So to this end, we have several activities planned. We will be providing disability training to all clinic staff. We'll be identifying and addressing accommodation needs of participants. We're cultivating and strengthening partnerships with trusted community-based organizations across the state to host and or support an MVP health event to best meet the needs of people in their communities. We're going to be providing up-to-date scientific information around COVID and other health issues that are offered in plain language and multiple languages. And I didn't mention, but I'm an epidemiologist, so we are also going to be collecting disability-related COVID-19 data. So data collection is a fundamental pillar of public health. And there's a saying that we measure what we treasure. So we can't determine if we're moving the needle on equity and inclusion for people with disabilities if we don't measure it. So at all MVP events, we will be measuring, asking about disability status. And our goal is to have disability status be included on the state's COVID-19 dashboard. So please be on the lookout for MVP events. A lot's going to be happening across the state. We'd love to have involvement. So feel free to reach out to me, go to the MyDDI website. So thank you.
Great, thanks, Sharon. Love the name MVP. And I'm going to steal the measure what we treasure as well. So that's fantastic. Again, kind of a little bit of follow-up, and I'll just open it up to all the panels. You know, how can family members, caregivers, for those with disabilities, assist in getting their loved ones vaccinated? We just heard a little bit about, you know, the MVP. program and some training, but as we talked earlier, there were still, sometimes challenges in regards to access, whether it's transportation, other parts. For the panelists who can maybe share some additional programs, ideas, thoughts in regards to getting folks and making ease of access a little more available for individuals with disabilities. Sharon, I'll start with you, and then I'm going to probably go to Annie next.
Great. I just wanted to add, which I didn't say, is that one of the things that MVP is going to be working on is we have a strong partnership with Wayne Health Mobile Unit. So, and we'll be working with hopefully other mobile units across the state and local health departments, but wanted to give a shout out to Wayne Health because they have been wonderful and are on board to have all their professionals that are on the mobile unit go through disability training and provide to make sure the events are accessible and to provide accommodations. So thank you.
Great, thanks. And he wondered if you had anything to add in regards to accessibility.
This is Annie signing. Yes, I also wanted to mention relating to transportation. Depending on the region that you live in, be sure to check in to see if you have free transportation options through some of the public transportation agencies. There are programs available out there. I also wanted to mention it's critical for people within the deaf, blind, and hard of hearing community that have communication access. They need to have communication access relating to getting the vaccine and making sure that information is accessible to the deaf, blind, and hard of hearing community. I also would encourage people to check the state COVID vaccine website. There's a lot of information that's available there relating to resources and how you can find a vaccine site close to you or a testing site close to you. Those are my recommendations and resources I would encourage individuals to check out. Also, we do know that a lot of people within our community, there's just a lot of information out there, right? A lot of information regarding COVID and the vaccine. So if you want to find accessible information, the state also has a page relating to different information about the vaccine effort and COVID itself and different resources in different languages, including American Sign Language. CDC also has a variety of resources in ASL and other videos and languages. So if you're looking for additional information relating to specifically COVID, those are great resources to check out. Thank you.
Thank you, Annie. Dr. Davidson.
Thank you. This is Melissa Davidson. I just really am excited to hear about the MVP program as well. I think that, compared to the very beginning when there was sort of limited access to vaccine distribution because of the refrigeration and things like that, now the vaccine is much more widely available. But I think that the training is really critical, and especially just to be aware for persons with disabilities. Even some of the community clinics that we have helped to host, just being able to have a spot for longer observation periods, for instance, for somebody that might have some special medical needs, just the whole flow, they just need to kind of plan ahead for that, and having space for like our autistic patients that wouldn't do well in a large group setting. So just kind of trying to prepare for your audience and have space and plan in place to meet the needs of the individuals, and then educating so that families feel comfortable that their family members with disabilities are going to be well cared for and well observed in that setting. So thank you for your efforts on that training.
Great, thank you. Want to circle back. We had another question, kind of a follow-up in the chat. So for you, Dr. Bagdasarian, there was a follow-up in regards to kind of expected timeline for the monoclonal antibody treatment for individuals, and also question for children under 12. So just wondering if you had some information that you could share on in regards to potential timelines and availability.
So monoclonal antibodies and really anything, and sorry, but this is Natasha Bagdasarian speaking. I have not been identifying myself before I speak. For monoclonal antibodies and for antiviral medications, for those who test positive, really the sooner you get started on these treatments, the better. And so I think the key is, if you test positive for COVID, to call your healthcare provider as soon as you test positive to see if you would be a candidate for these medications. There are still some limitations in terms of who can be prescribed, and there are some issues with the oral antiviral in terms of making sure there are no drug interactions. So for individuals who are on other medications, there does need to be a verification of what medications you're on and perhaps some dose adjustment, or even pausing some of the other medications. So calling a healthcare provider as soon as you test positive is key. But if it's been a couple of days and you haven't reached your healthcare provider, don't give up. I would still try to get a hold of your healthcare provider and make sure that you've had a chance to discuss with them whether you'd be a candidate for either a monoclonal antibody or an oral antiviral medication. We also have injectable antiviral medication. So there's a variety of options at this point in time, and it's really a matter of seeing which one would be best for you. And then of course, Evusheld is the monoclonal antibody, the long-acting monoclonal that can be given for those who are immunocompromised before they've been exposed, and it can provide protection for about 6 months. So lots of good options out there. It's just a matter of us getting the word out. Initially, when these medications and treatments became available, they were in very, very short supply. And I think the narrative got out there that these medications were really hard to find, and that it was hard to be eligible for them. And that's no longer the case. We now have supplies of many of these medications widely around the state. So please do talk to your healthcare provider to see if you'd be a candidate for one of these. Thanks.
Tim speaking. Great. Thank you. That's wonderful information to share. Well, this has been extremely informative. I know just personally, I've learned a lot today. Just excited for getting the information out there as we talked about, and as we all work together to support individuals of all abilities. In closing, I want to make sure to give each speaker a minute or two for closing remarks. If we missed something, if there was information you wanted to share, but we'll go around table and allow each speaker for a minute or two just in closing. And we'll start with Dr. Davidson.
Thank you. Yeah, I just really, again, appreciate the opportunity to be involved in this panel and to have ongoing discussions. I think that is the most important thing, is that we know that there's never going to be a time that we're completely without COVID. It's going to be like the flu. It's going to take different forms going forward. And so not to be afraid of changes in terms of how we respond to it, and to continue to have conversations with your primary care team and your specialists. Thank you.
All right, thank you. Sharon.
One thing I want to mention, and just to highlight, is that as we develop events for people that include people with disabilities, to make sure that we're not creating separate events for people with disabilities, but that all events, all healthcare is just accessible to everyone. So I just wanted to emphasize that. And then also, you know, I'm a glass half full kind of person, and I think there have been some silver linings related to COVID. And one of those is that it shed light on the disparities that exist for people with disabilities, not only during the pandemic, but before the pandemic and for decades before the pandemic. And these disparities have put people with disabilities at increased risk for several health conditions: heart disease, cancer, diabetes, depression, and others. And so we see, you know, going back to our MVP effort as this wonderful opportunity to optimize the impact of our collective funding to meet disproportionately affected people where they are in their communities. And we'll be addressing some of the social determinants of health. Those are the conditions and the places where people live, learn, work, play, and worship, so that all Michiganders, including those with disabilities, have the opportunity to attain their full health potential. Thank you.
Thank you, Sharon. Annie.
Sure, this is Annie signing. Obviously, I'm a person with disability, and I think as we move forward, as an individual with a disability, I think we need to think about this inclusive mindset in any conversation that we're having, whether it's with a medical provider, with a colleague in the workplace, or a family member or friends. It's important to have that approach of making sure that we're treating each other with respect, mutual respect, but in a way that's we all feel welcomed and included and part of society. The conversations like this are critical, and that we have to continue framing things where we're going, say, like after everything that we've gone through, where are we going to go? I think it's important to have these conversations. But I'd like to wrap up by saying, if you are a service provider and you work with people with disabilities, if you are not sure about what accommodations we need, or you have questions about our experience, ask us. We want to be involved in this interactive process. Engage us. We don't want assumptions to happen and then miscommunication to happen and have situations go awry. So include us as a part of the decision-making process. Make us included. Thank you.
Great, thank you. And Dr. Bagdasarian.
Thanks for the wonderful discussion today. This has truly been a privilege to be able to engage with all of the panelists here today. I do just want to close out by just reminding everyone that the pandemic is not over. COVID is not going away. COVID is going to be with us. And again, the best way to protect yourselves and your loved ones is to get vaccinated now before the next surge of cases. Michigan is, we are lagging in terms of other states, in terms of our vaccine uptake. And the best way to protect ourselves as a state and as a community is to make sure that no one is left behind. We have tools, we just have to utilize them. That was the first thing. And the second thing is, as we're in this lower risk phase for now, I don't know how long it will last, but as we're in this lower risk phase, I just want to urge kindness and respect to those who are making choices in terms of masking and whether or not they're participating in certain activities because of their own risk or comfort level. And I think that we just need to be respectful of the decisions that each of us are making that are best for ourselves and our family members. Thanks.
Tim speaking, absolutely. And I guess on a closing note from Special Olympics and kind of bringing some things together, I'll give a plug for an event that's happening starting on July 31st to August 6th. Special Olympics Michigan, in partnership with Special Olympics International, and Wayne State University, and the Michigan Department of Health and Human Services, is putting on a Special Olympics International sporting event. But not only the great things about sports, but really focusing on the importance of community, inclusion, and health. And so I'm really excited to partner with a lot of folks and answer additional questions. As you heard from all of our great panelists, the importance of respect, the importance of understanding, the importance of communities coming together on this. And so really appreciate everyone joining us today. In the comments, there were some questions, thoughts, individuals sharing about personal experiences with COVID and the vaccine, and appreciate that. Just in general, I think really good information in nature is if you have questions about the vaccine or individual risk, please speak with your healthcare provider on those. Again, appreciate all of the knowledge, information today. And we'll close with just the message for everyone out there is choose to include. Thank you so much, everyone.